Welcome to SimplyRN. This video is for educational purposes only and not indicated for clinical use. Today's topic is bacterial meningitis. Meningitis is the inflammation of the meninges, which are the inner lining of the brain and spinal cord. Bacterial meningitis is inflammation of the meninges due to bacterial infection, and it is considered the most severe and contagious form of meningitis. Other types of meningitis include viral meningitis, which is the most common, fungal and parasitic are rare, and there are also non-infectious causes of meningitis, such as autoimmune disorders and cancer. Meningococcal meningitis is the most common cause of bacterial meningitis. It is caused by the bacteria Neisseria meningitidis, also known as meningococcus. It is a gram-negative bacteria that can lead to severe sepsis, also known as meningococcal septicemia. Meningococcal meningitis spreads by coughing and close contact, such as kissing, sharing foods, and drinks with someone who is sick or who carries the bacteria. It spreads easily in crowded living situations, such as college dorms, prison, and homeless shelters. All meningococcal cases need to be reported to the local and state Department of Public Health. Besides droplet transmission, there are other ways bacteria can enter and infect the meninges. For example, bacterial infection of the blood or bacteremia can cross the blood-brain barrier and infect the meninges. Middle ear infection and sinusitis can extend the infection to meningitis. Bacteria can also enter through a dural defect, which is a tear or abnormality in dura mater that covers the spine and causes meningitis. Nosocomial bacterial meningitis is the result of the manipulation of the meninges during neurosurgical procedures. Nosocomial means hospital-acquired. Bacterial meningitis is the only type of meningitis that can be prevented by vaccines. For example, infants are given the Hib and the PCV vaccines, and children around ages 11 to 12 are recommended to get meningococcal vaccines, followed by a booster vaccine at age 16 or before start of college. Signs and symptoms. The classic triad of symptoms of meningitis are high fever, neck stiffness, also known as neutral rigidity, and photophobia or sensitivity to light. About 70% of patients will present with at least one of these symptoms, but only 41% will have all three symptoms, which are most commonly seen in elderly patients. Agitation and altered mental status are often the first signs in adult patients, and infants usually present with high-pitched cry and bulging fontanelle. Some patients may present with purpura fulminans, which is a petechial rash of small red, purple, or brown spots due to meningococcal meningitis. The rash spreads rapidly and commonly appears in the feet and hands, but can extend to the entire arm or leg. There are also two physical exams that can be performed in patients suspected to have meningitis, and they are frequently tested on nursing exams. The first one is called Brudzinski sign, and it is tested by having the patient lay down supine on the back, and you would flex their neck, and it will cause them to have involuntary flexion of the knees and hips due to pain. That is called a positive Brudzinski sign. The second test is called Koenig's signs. With this test, you would have the patient lay flat with their knees bent, and you would attempt to straighten out their legs. And if there is resistance or pain with the knee extension, then that would be a positive Koenig's sign. These two positive signs are due to meningeal irritation, but not all patients who have meningitis will test positive. But memorize them for nursing exams. The gold standard test to diagnose meningitis is analyzing the cerebrospinal fluid or CSF, obtained via a lumbar puncture or spinal tap. A CT scan of the head is usually done before LP to rule out herniation. We will go over the difference between bacterial and viral CSF results, because they are also tested a lot in nursing school. The CSF from a patient with bacterial meningitis will appear cloudy, with low glucose level and high protein level. Viral meningitis sample will appear clear, with normal glucose level, low, but typically normal protein level. Both will have elevated WBCs in the CSF, but it will be significantly elevated in bacterial meningitis. CSF samples are also sent for gram stain and culture to identify the organisms causing the infection. Standard treatment for bacterial meningitis includes antibiotics and supportive care. Timely administration of antibiotics is essential because delays in the administration of 3 to 6 hours are associated with increased mortality. Antibiotics such as ceftriaxone plus vancomycin are initiated to provide a broad spectrum coverage until the pathogen is identified on the CSF culture. Antibiotic therapy can then be narrowed down based on the organism causing the infection. Don't forget to teach patients the importance of finishing all antibiotics to avoid resistance. As mentioned before, patients suspected to have bacterial meningitis should be placed on droplet precaution with a single private room until they have received 24 hours of antibiotics. Droplet precautions include surgical masks, goggles, and gloves. Teach the patient and family to let those who have been in close contact know about the diagnosis so they can begin prophylactic antibiotics, and all visitors should wear masks. Supportive care of meningitis includes monitoring neurostatus and signs and symptoms of increased intracranial pressure, or ICP. Early signs of ICP in adults include altered mental status, restlessness, and irritability. Measures to prevent increased ICP include keeping HOB at 30 degrees, keep head midline with neutral neck position, no bending hips or lower extremities, avoid coughing or sneezing, avoid straining with bowel movement, avoid tight or constricting clothing, and minimize stimulation by dimming lights, keeping a quiet environment, and speaking in whispers or quiet voices. Monitor and treat fevers and headaches with acetaminophen and ibuprofen. No aspirin use in children due to the risk of Reye's syndrome. Monitor for low blood pressure, which can be a sign of sepsis. Notify provider immediately and support with IV fluid as ordered. I hope this video helped you understand more about bacterial meningitis. I will see you next time.